Board leg is an important concern for the parents. How the parents' son or daughter's leg is not straight. That's a good deal of concern in the growing child, 2 to 4 years. And actually, a good amount of these cases are physiological. They are neither pathological, no rickets, nothing else. So, and these physiological cases, they outgrow the problem by 4 to 7 years. But in between this 4 to 7 years, 2 to 4 years of the beginning of the disease and the journey, it's difficult to accept because whether you are missing something pathological. Rickets is by far the commonest in this presentation. We know that genetic rickets that present early, 6 months to 2 years, and nutritional rickets that do present 2 years and onwards. So thereby, it's essential to differentiate this bow leg from rickets. Rickets is diagnosed by the compatible clinical scenario with an X-ray data of cupping, fraying, and your bending, clistic fractures, and others. So and then your this and supported by the ALP, alkaline phosphatase, your tissue non-specific alkaline phosphatase elevation two-folds higher than the normal, and these three comprises the diagnosis of rickets. And to know the exam or to diagnose whatever you call is hypocalcemia, hypophosphatemia. That differentiates two types of rickets, hypocalcemic and hypophosphatemic. And further elaboration, perhaps you can refer this child to your specialist. Up to this stage, good amount of cases can be managed. And there is one more your entity. There is the metaphyseal dysplasia. They appear like rickets or the physiological, but the lab data supportive of rickets, as I told earlier, will be negative over here. And the achondroplasia, they do have specific clinical features. The Morque's grotesque-like appearances, according to short stature, very much dysmorphic body. They're distinctive. Their differentiation from the physiological is not that difficult. And lab data, all achondroplasia, they have different lab X-ray data. Biochemical data will be negative over here. And you have mucopolysaccharidosis, multiple hereditary exostosis. This entity, they have their own features, and hyperphosphatasia with low alkaline phosphatase level. They are also differential diagnosis of this board leg. So the long list 4 to 6 or 7 entity, common to uncommon, and make sure that you are not missing anyone, and then count the parents and counsel the parents. Look, your son or daughter is going to be cured or is going to grow out of the problem when she or he is 4 to 7 years old.